Well, in early weeks and months of the pandemic, the public health expert Dr. Pankhania was a regular guest on this programme, and we know many of you took comfort from his sage advice. We're delighted that he can join us again this evening at a time when we all feel perhaps a bit overwhelmed. I certainly do. We should say, of course, that he is independent of the government, so his views are his own. Well, good evening. Thanks for coming on. How are you?
Very well, thank you, David. Thank you.
That's good to hear. Lots of questions. Your ears must have been burning. The first relates to the virus's ability to live on surfaces. Pat in Kingswood says she's still wiping down all her shopping, but lots of people are no longer doing so. And Rachel White asks, should she still be quarantining her post?
So my piece of advice is, listen. Don't drop your guard. Whatever you do, you may just give things a wipe and clean. But the most important thing is your hand. It is your hand that will introduce infection to your nose and mouth. So no matter what you touch, and you will be touching a lot of things, the end result is you keep your hands clean. Everything else you can try to keep clean, but it's not always possible. So keep your hands clean, which you can do.
We've had a few questions about herd immunity. Now, Lynn Smith from Wells asks, might it be a good thing that lots of young people are becoming infected to assist with herd immunity? And Clive Pinnell asks, would it be a good idea to let the virus spread among the young and healthy while protecting the elderly and most vulnerable?
No, and I emphatically say no, please don't do this, because you don't want to create immunity by infection. We only create herd immunity by immunization. If you were to go down that route of let us get infected, you will get many, many unknown consequences. We learnt yesterday, for example, that there was a second infection after a person had been infected earlier on in the year, and then he got infected again, and the second infection was a lot worse than the first one. So there are unknown consequences, and not everyone who is in a safe group who gets infected will come out of it unscathed. Therefore, the bottom line is, please don't get infected, don't infect others, and the herd immunity by infection route is nonsense. Don't do it.
Anna has contacted us. Should all students be forced to stay at university till they are clear of the virus, rather than heading home and spreading it around the country? A bit harsh, Anna, but what do you think, Doctor?
Yeah, well, of course, anyone who is infected and infectious and also is a contact of an infected person cannot be traveling around the country. So that is very simple, very straightforward. If you are a case or if you are a contact of a case, no matter who you are, a student or anyone, you shouldn't be out and about. So that removes all those people that we are talking about. The other people, we take a measured decision, and the measured decision is as follows. Could you possibly be infected? Could you possibly be infectious? And the best way around that is you can also do rapid tests like the University of Exeter is doing, but that we take on a case-by-case basis. The bottom line is, if you are a case or you're a contact of a case, you're not going anywhere, you mustn't go anywhere.
OK, I don't know if you've had your flu jab yet, Doctor, but Doug White asks, might the flu vaccine offer some protection against coronavirus, especially if it helps the body to generate these so-called T cells?
The answer is no. The flu immunization only protects you against the flu, influenza, seasonal influenza. And my advice, and remember, I'm coming as an independent doctor, my advice is please get immunized, all of you, all age groups. And if you are not entitled to free NHS seasonal influenza vaccine, pay for it. It's between £8 to £12. It is really worthwhile protecting yourself against something that you can protect against. So get your flu jabs, but get it as soon as possible. This is important. OK, I think they're in quite short supply at the moment.
Now, Halloween and bonfire night are both approaching. Jeanette Redman wonders if you are worried about gangs of children spreading COVID from house to house.
Well, I would prefer if gangs of children were not becoming gangs and moving around, because we need to restrict our circle of movements. So whilst the gangs of children in the short encounter at your doorstep are unlikely to infect you, the bigger problem is I don't want many little gangs forming and mingling amongst themselves, because they could pick up infections and then bring that infection to mum and dad or granddad, grandmother, that sort of thing.
Okay, gangs is perhaps a harsh word, isn't it? Groups of children, we should say.
Yeah.
Roger
Group of
Moss
children,
says, has COVID-19 mutated, and how many strains are there?
So, of course, all of these RNA viruses mutate all the time. So we have many branches by now. The unfortunate thing is, whilst we have many branches, none of the branches are predominant, and none of the branches are what we would call less disease-causing. So whilst we have many branches now, they're all disease-causing.
Okay, we're coming to the end of our time. Chris from North Wiltshire asks what proportion of over 70s are symptom-free but COVID positive. Now, we used to think that older people would suffer a lot, but some people seem to be having mild disease. I'm thinking of President Trump, for example.
Yes, so we don't really know, because we've never been able to look for it, because we haven't tested extensively. So what my advice always has been, consider everyone, everything, at every time to be potentially infectious. We don't know who is and who isn't.
Right. Just one quickie about Christmas. Are we going to be able to celebrate in any meaningful way, do you think, this year?
It will be, but with a lot of caution and a lot of pre-preparation. From December the 1st onward, you would have to start preparing for meeting on December the 25th, slowly and carefully, if at all.
OK. Well, thank you very much indeed. Hey, your garden's still looking magnificent, even in the dark. Thank you.
Thank you.
Great pleasure to have you on the programme again. Great advice. Thank you.